Good morning. The second panel is going to be looking at industry approaches, and based on the last panel, I think that it's important, as you can see, to talk about all different sectors of the all different parts of the economy working together on improving workforce development and contributing to the development of human capital and skills for our economic growth. I'm excited to have a panel here that represents both researchers who are studying workforce development from the industry point of view, as well as some practitioners, particularly in the two fields I think that have been leading the way in sector development, and that would be in healthcare and manufacturing. So up here we have Mark Popovich, who is a program officer at the Hitachi Foundation and has been working on, I'm not sure how long, but on a project of Pioneer. Too long on a project for pioneer businesses that have made wonderful investments in their frontline employees and also continue to turn a profit. I also have Jim Van Erden from the National Association of State Workforce Agencies, also known as NASWA, and he is the senior policy advisor there and a head researcher there for quite a long time. Laura Chandler is the executive director of the Southwestern Alabama Workforce Development Collaboration. Laura and I had an opportunity to meet when the Atlanta Fed hosted a listening session there that went into our long-term document about what's happening in long-term unemployment. And finally, we have Terry Fontenot, the president and CEO of the Women's Hospital in Baton Rouge, Louisiana, and also the 2012 chair of the American Hospital Association, who I know can contribute a lot as well in terms of what is happening on the ground from a practitioner's point of view. So I want to open with an individual question for each of you, and starting with Mark, I want to hear from you a little bit about, based on this long-term study that you've been doing, can you talk to us a little bit about how employers are integrating workforce strategies into their operations, and particularly with strategies that would be relevant to a Mississippi audience?
Sure, thanks. So this work came out of a long series of investments that we were involved in, and many others before the Hitachi Foundation, the Mott Foundation, the Ford Foundation, the Rockefeller Foundation, that had been looking at sector-based efforts, industry-organized engagement on the supply and the demand side to address the creating economic opportunities for lower-wage workers to get jobs, hold those jobs, and advance in them. Part of our experience was we've often worked at the intersection of the role of business and society and ways to address poverty. So one of those key roles is the corporation or the business as an employer, creating the pathway of opportunity. And we very strongly believe in the voice of employers and on the demand side having a voice in trying to bring these things forward. But we also had experiences where the employer's voice was a little too loud and a little too unfiltered. In the manufacturing sector, we had a partnership between a community college and the Precision Metal Forming Association in the Twin Cities. It turns out to be a great program, but initially they shot really low. They really did a sort of a manufacturing 101, and the main criteria that employers looked at is the attendance record. So it wasn't really skill building, it was kind of a soft skill test. The other example at the same time was in warehousing and transportation related in Cleveland, and they came up with 4 courses at the Tri-C community colleges, and in the end you'd come up with an $11 an hour job, but you could go to the 8-week welding course and do better than that. So nobody completed that course of study. So in both cases, the community colleges or the technical college said back to the employers, we think you're shooting low or high, and the employer said, we appreciate your saying that, now go do what we told you to do. And it really didn't work out great for anybody involved in those. So there is this intermediary role, and I think Maureen and others, Jack Mills and others are going to talk about that a little bit more later on. But there's an intermediary role that really needs to be played to bring together the voice and have a conversation about it that really leads to insight. And the guiding rule here is the more meetings you have, the fewer insights you actually get. That this work is really not about meetings, it's about learning from each other, and often that's in informal settings in the place of the employer. So we were a little frustrated with what we were doing, so we were really, what we were seeing out there, there was progress, but we didn't think that there was enough of it, and we are always looking, because we're a relatively very small foundation, looking for a niche that we think that we can fill. And our niche was around these pioneer employers. We picked healthcare and manufacturing because they seemed like the yin and the yang. It turns out they're not so much the yin and the yang when you look at it in that way. But we were looking at employers that had two kinds of results, two sets of results. One was that they were great businesses, that were growing fast, that they were doing well in terms of their basic metrics of the business. The other was that lower wage workers were getting earnings gains that were substantial, and those earnings gains were sustained and the career advancement was happening for them. So we didn't have a theory about how they were doing that. This is a positive deviance research strategy. We wanted to find out in the real world, how do you do it? So we looked at working with others. We did about 100 cases of these, what we would call pioneer employers, and you can look at all of these cases at pioneeremployers.com website that we built up. But I'll give you two examples, one in healthcare and one in manufacturing. And the job categories that I'm talking about have not changed, but the jobs have changed. And I think that's what we're seeing a lot of in the workforce, in the workplaces that we're seeing now. The first one is in healthcare, and it's a federally qualified healthcare center in rural Colorado called High Plains Community Health Center. They were in peril of going out of business because they're seeing a lot of patients. They're the primary care provider in that community, but they couldn't get more than 3 doctors to move there, and their costs were relatively high, and their productivity was relatively low. They trained their medical assistants and changed their practice model to engage the medical assistants in the direct patient care team, and those they got the triple bottom line gain that is the absolute home run. They got substantial earnings and wages and career advancement and job latticing for the new career of medical assistants and health coaching and patient navigator. They got tremendous patient outcomes. And the most important thing is they increased provider productivity. Those are doctors. They don't like to talk about productivity, but it's measured and is measurable. They increased provider productivity by 50%, not 50% in like a 3-year period of time at a modest investment in the training that they were able to do. That allowed this clinic not only to survive, but to thrive. I'll take a manufacturing example. This is Pridgeon & Clay, a precision metal forming Tier 1 auto supply company. You have both clinics and a lot of Tier 1 auto supply companies. That's why I picked these. This is in Grand Rapids, Michigan. As a result of developing some innovation, they're able to make a fueling assembly out of 1 part instead of 2 parts, and that's a substantial savings for the auto company. But they needed to train the basic brake press operators in a new set of skills because they were using new materials. Just for entering that training program, if you were going from material handler to automatic brake press operator, you got a 50% increase in your hourly earnings, and when you completed it, you got another 7%, and when you learned setup, you got another 10% on top of that. So these are real returns on investment, and I'll tell you the value proposition as I see it is the WIA system at the height, the workforce investment system, at the height of the investment of the stimulus bill was about $4 billion. Across all federal workforce adult training and education programs, it's about $19 billion across all of those. Employers have between $135 and $175 billion that they are in their budgets to focus on training and talent development. Now, too much of that goes into the folks who are the highest educated and the highest paid already, but if you can split off 10, 15, 20% of that to work on this segment of the workforce, these incumbent workers, you're talking about a real investment that has real payoff for everybody involved, and the payoff in value for the employers is what makes that a sustainable model.
Are we on? Jim, Can you talk a little bit about NASWA and what you're seeing in terms of challenges and opportunities for industry collaborations on the ground?
Sure, I'd be happy to. And I'm okay with the microphone. A couple of things I want to say just in general about collaborations and how public-private partnerships work. I think there's a couple of key factors that need to be involved when we talk about any of the communications, any of the examples that we're going to hear about today. And first of all is communication. We need to make sure there is a very strong communication link between private industry, between the workforce sector. We need to also understand expectations. We need to identify the outcomes we can achieve, and then we need to think about the realities, the funding, as Mark and others have mentioned. I know a lot of you are here from both sides of the aisle. One of the things I observe when I travel around and talk to folks, and this is over many years, a lot of workforce folks will say, if we could only get employers involved, it will help solve our problems. And one of the things they're looking for, clearly, is a partnership. They're looking for someone to come and tell them what's going on. Now, how many of you are employers in the room? How many of you know what skills you're going to need a year from now? How many of you know what your job descriptions will be a year from now, 2 years from now, 3 years from now? We have this issue of thinking about employers have all the answers. If we could just get them to the table, if we can just create the partnerships, then everything will be solved because employers know where everything is going. And that's true in some cases, but it's not true in every case. And when you're thinking about a workforce system and you're thinking about how do you align it and how do you prepare people, whether it's a K through 12 system, whether it's in community colleges, in higher education, or folks who are just getting workforce training, understanding where that market is going is a very critical issue. So we spend a lot of time thinking about that. Let me ask the question on the other side. How many of you on the employer side know what we're talking about when we say the workforce system? If we held up a little mental model for everybody and said, describe the workforce system, it's kind of like the elephant. You'd all describe different parts of it. Well, I work with higher education. That's part of the workforce system. I work with community colleges. That's part of the workforce system. I work with the K through 12. I work with a knowledge supply chain. I work with how we get people up into our place of employment and what skills they need. But when we think about that partnership and how it comes together, we both need, when I say but we both, the employers and the workforce system, need to step in the other's shoes and get an understanding of how those the dynamics that each one of us are facing are going on. So that's a really key issue, I think, as we look at what is a successful partnership and what we're seeing in our system. So understanding the workforce system, there's many programs in the workforce system. They're stovepiped. We have the Employment Service. We have 3 types of Workforce Investment Act programs. We have other specialized programs, senior community service employment programs, a lot of different programs that work together to help get people into the workforce and sustain them while they're in the workforce. What we're finding is that many of our locals, many of our folks are thinking about this. I remember, I can't do this very often, but remember back a few years ago in the Department of Labor when we started talking about who is our customer. It wasn't that long ago. It was really, really difficult to talk about our customer as being an employer. We had JTPA at that time. We served disadvantaged adults. We served disadvantaged youth. And we were trying to help folks who were at risk and to get back into the workplace. But the mere thought of saying the employer is a customer was really, really a problem. Today, when you raise your hands here and you say how many of you understand that employers are part of the customer base that we're looking at, you find that most of the hands go up. So it's been a really dramatic shift in that. A little while ago, you asked what the challenges are to the system. We had our annual conference, NASWA did in Denver. And as part of that conference, we did a lot of polling before the conference, and we did a lot of polling at the conference to find out what our folks in the system thought were challenges. And if you could just take a couple of seconds here, I'd like to talk about a couple of them. When we talked about what the strengths and opportunities of the workforce system is, what they were facing, some of the key ones we found were providing assessment and reemployment services, coordinating a set of comprehensive services, building better relationships with workforce providers and education systems, developing better data outcomes and effective strategies. What were the threats? The feeling the system is not well focused, not a national system, but asked to do many things with limited resources. Does anybody know what the level of funding is for the Employment Service nationally? It's about $720 million. Do you know what the level of funding was in 1983, 30 years ago? $720 million. last semester, gee, I'm switching back to education, sorry, last semester, the last summer, the summer quarter, under sequestration, the amount of money that was released to the adult WIA program for 3 months of work was, anybody know? We're talking about the national dollars, $12 million. Okay? So when we ask our folks, what are some of the issues that they're facing? The issues of funding come up, but it's not an issue of doing more with less. We always talk about maintaining what we're doing with less. And when you really see the dramatic cuts in funding that are coming down the road, the system is stressed. The system is looking for other ways to work with employers, to engage in partnerships, to work with the $19 billion that Mark talks about that's available in the system. So when we talked about priorities, we talked about aligning workforce programs with training efforts of other groups, ensure they match the needs of customers, carefully analyze the current governance structure to see how we're organized, see how the workforce system is organized, and how it can best deal with employers. Look for alternatives in the funding system, leveraging partnerships, working with foundations and other corporate partners, and develop strategies to recognize the needs of the unemployed and how to apply those strategies for their reemployment effectively. So the goals of the organization are there to work with the folks that they need to get them into the workforce, to sustain them in the workforce, and to engage in partnerships. And finally, I'll just come back to one final thing. We asked at the conference for the folks to tell us what they think, and I'm going to look for it here real quick, what they think the top 3 focus areas should be for the next 12 months for the workforce system. And the first one was, what's the topic of this conference? Increase and improve business engagement earlier in program design. So the workforce system that you're looking at is very much aware of with partnerships, the validity of having strong business partnerships, and how do you engage those partnerships early in the system. Increase flexibility of funding. We talked about stovepipe funding. There was a huge hue and cry when $12 million went out to the adult system this summer. Can we use money from other resources? The answer? Very limited, but pretty much no. When we went through shutdown for the continuing resolution, the employment service was fully funded because of the way it's funded. There was no money going out for the first 3 weeks of this month to adults and dislocated workers. The answer was, could we use some employment service funding to cover the gap? The answer was no. So looking at how we can increase flexibility in funding to better meet the needs of the employers and the workforce system and the workforce that we're trying to serve is really important to our members. And then again, leveraging resources. How can we better leverage resources with employers, with higher education, with community colleges, and with other public programs? These are 3 of the key things that our system, the workforce system, believes are important and that they should focus on in the next 12 months.
So that was a really great response based on the policy and research perspective.
Sure. First of all, please forgive me. I think I've gotten to a point I'm so cold that my teeth are chattering. So it's not that I'm nervous. I think my fingers are numb. But nevertheless, my organization is Southwest Alabama Workforce Development Council. We go by the acronym SAUDC. I'll give you a little bit of background. The state of Alabama under Governor Riley was broken into 10 regional workforce development councils, 10 regions. In the state, and it really was really a great infrastructure for our state and really at the local level. And the thrust behind that was essentially the community colleges in our state, and we have over 60. I know that Mississippi has 15, which might be a little bit easier to manage. But for us, the community colleges were going, submitting applications for workforce development, training, and education to Montgomery. And Montgomery really didn't know what the local needs were. So the state was divided into 10 regional workforce development councils. All councils are required, to have a minimum of 20 private sector employers on the boards, on the councils, and 75% of membership overall has to be from business and industry. And we have a very strict set of operating guidelines. Our particular region, we took that structure in a little bit further. We established a standalone nonprofit organization. We have 45 members of the council, 75% of which are business and industry. We also have, and this may seem like a lot, but they're very engaged, over 90 ex officio non-voting members, and that's our community colleges, that's our K through 12 folks. Really anyone in the workforce development system that is operating in the workforce development system. And a lot of folks, I'll hear them describe our organization as the umbrella organization. The way that we're set up is we're really a facilitator. Mark referred to it as an intermediary. That's exactly how we were structured. When I came on board about 3.5 years ago, it was a fairly new organization, about 1.5 years in existence, really was working throughout our 8-county region to establish buy-in, really understand what the needs were of the community. What we lacked was a strategic framework, really understanding who we were, what we wanted to do, and how we wanted to do it. And so we did that, and as an organization, our vision is an integrated workforce development system, integrated comprehensive workforce development system, and we do that through strategic partnerships. And we very clearly stated our customer, and we do have a dual customer approach. First and foremost, are our employers, but it's also the communities where they exist. So we have a dual customer approach in a sense. It's not only the employer, which drives everything that we do. We're very much business driven, business led, but also the supply side. And I know when I came on board, I'm an old apartment developer, so workforce development was not in my previous profession. And a lot of folks talked about, I asked a lot about, the organization, and most folks would respond, with sort of a conceptual, we understand demand in order to influence supply. And what we want you to do, Laura, is we want you to go out there and do some cluster work. And I said, well, what does cluster work look like? And nobody, if you asked different folks that question, you might get different answers depending on, who was answering the question. So we were very fortunate about 6 months into my, employment with Saudi C, after we had developed our strategy map, balanced scorecard, have a whole set of measures, which I'll go a little bit into, to be invited to become a part of the National Fund for Workforce Solutions. And I don't know how many of you are familiar. Mark is one of the investors, one of the original folks who established the National Fund for Workforce Solutions. But their mission is really the career advancement of low-wage workers through a substantial employer engagement. And really what it did for our organization, it gave us a framework. It gave us a discipline for doing cluster work. It made it very clear, how to establish our clusters and that work and how to measure that. So as it relates to employer practices, as it relates to participant outcomes, as it relates to policies and systems change. So subsequent to that, we have established 4 clusters, and 3 of those are actually considered manufacturing. We have aviation, maritime, and then also industrial construction and manufacturing. Really, many of those, the employers are looking for the same thing, the skilled worker. And then we also have our industry partnership or cluster, or whatever terminology you use in healthcare as well. So, it's been a fantastic partnership. The way that we measure success, we really measure it on 4 levels. We measure it for our organization. We have a set of performance measures for our organization. We really say, that if we're doing our job and we're doing it well, our customers should be saying 2 things. They should be saying that they have access to the workforce development system and someone is advocating for their needs. So you can really see that in light of the customer being the employer, but also the customer being the worker. But then also that there is a large qualified candidate pool. That is a key objective for our organization, and the way that we measure that, about 2 years ago, we sent out a survey. We do a lot of, user satisfaction surveys to understand exactly how we're doing in the work that we're doing. And that particular measure, though, we went out to 25 of our top employers throughout our 8-county region. We asked them, out of all the individuals that are applying for your entry-level positions, how many are actually qualifying? And that percentage came back to be 17% for our top 25 employers. So in other words, less than 1 in 5 individuals that were going and applying for those jobs were actually qualified for those jobs. So it really established a baseline for us, and we didn't intend on measuring that annually because we feel like it's going to take a little bit more time to actually affect it. But all of the work that we do within our clusters, which I love what Ted Abernathy had said, you do what you can do with the resources that you have, and then the next day you wake up and you do the same thing. And that's exactly what we do. So.